Hello, everyone. Welcome back to my channel Healthy Panda Official, where I present you beautiful informative video about surgery and health science. In today's video, we're going to dive into a crucial topic, dynamic hip screws. Whether you're a medical professional or just someone curious about orthopedic procedures, this video will provide you with a comprehensive understanding of dynamic hip screws, the procedure, their benefits, and the recovery process. So, let's get started. What are dynamic hip screws? Dynamic hip screws, also known as DHS, are orthopedic devices used to treat certain types of hip fractures. These fractures often occur in the proximal femur, or the upper part of the thigh bone, especially in older adults due to osteoporosis or falls. A dynamic hip screw consists of a plate, screws, and a specially designed mechanism to allow controlled movement during the healing process. The procedure. Next, let's talk about the procedure itself. The surgery involves making an incision near the hip joint to access the fractured bone. The orthopedic surgeon carefully aligns the fracture and secures the dynamic hip screw. The screws are inserted into the bone, and the plate is positioned along the femur. The dynamic aspect comes into play here, as the screws allow some movement at the fracture site, which aids in the healing process. Benefits of dynamic hip screws. Why choose dynamic hip screws over other treatments? Here are some benefits. 1. Stability. The plate and screws provide stable fixation, allowing patients to bear weight on the affected leg earlier in the recovery process. 2. Controlled movement. The controlled movement at the fracture site stimulates bone healing and reduces the risk of complications like nonunion. 3. Minimized soft tissue disruption. Compared to more invasive procedures, DHS involves a smaller incision and less disruption of surrounding tissues. Recovery and rehabilitation. After surgery, the recovery process begins. Patients usually need to use crutches or a walker initially and gradually transition to full weight bearing as advised by their doctor. Physical therapy plays a crucial role in restoring strength, flexibility, and mobility. Full recovery can take several weeks to a few months, depending on the individual's age, overall health, and the severity of the fracture. Like any medical procedure, there are potential complications associated with dynamic hip screws. These may include infection, blood clots, implant failure, or nerve damage. It's important for patients to closely follow post-operative instructions and attend follow-up appointments to monitor their progress and address any concerns. To wrap up, dynamic hip screws are a valuable tool in the orthopedic world, offering stability, controlled movement, and a quicker return to weight bearing for patients with certain types of hip fractures. If you found this video informative, don't forget to give it a thumbs up and consider subscribing for more medical insights. Thank you for watching, and remember, knowledge is power. Don't miss out on our next video. Subscribe now and stay tuned for more in-depth medical discussions. Connect with us on